Hello and welcome to yet another episode of Health Mantra with me, Dr. Stacey Fernandez. In the studio with me today is Dr. Nathaniel Pinto, consultant pediatrician at Manipal Hospital, Goa. Dr. Nathaniel completed his MBBS at the Goa Medical College and went on to study MD Pediatrics and now practices at Manipal Hospital, Goa. Dr. Nathaniel, welcome to the show.
Thank you, Stacey, and thank you, Prudent Media, for having me here on this stage.
Yes. So, Doctor, today we will be discussing about immunizations in children. So, just to give a brief to our viewers, what exactly is the history of immunization in India as well as in the world?
Yes. In India, the immunization was started as a part of the expanded program on immunization in 1978.
Right.
Then onwards, in 1985, it was named as the Universal Immunization Program, or UIP. Okay, that's what we know it as of today. And in 1997, it got incorporated into the National Reproductive and Child Health Program. So from then onwards, it has been a part of this. So this is a brief history of our immunization program, how it was instituted and where it is now.
Right. So it is mandatory for every child who is born in India to be immunized.
Definitely, it is definitely recommended, and this is what we will be discussing today. What is the importance of doing so? Yes.
So, doctor, how do vaccines exactly work on children?
Yeah. So vaccines form a part of an immunity called active immunity. Okay, and there is something called passive immunity. Now, what is this active immunity? Active immunity is something that is triggered in the body after an infectious organism enters the body, and this in turn causes the immune system to be activated. Okay, so what a vaccine does is vaccine mimics a natural infection. A natural infection would cause a full-blown disease, but what a vaccine does is it causes a subclinical kind of infection. Patient doesn't manifest with the symptoms, yet it does the job of activating the immune system so that the child reacts to that particular vaccine, to that particular organism, and develops immunity also against it without suffering from the disease.
Doctor, what are the broad categories that vaccines can be divided into?
Yes. So broadly we can divide the vaccines into two types. One is the live attenuated vaccines and the second one is the inactivated vaccines. Now what is the difference between the two is that the live attenuated vaccines, the particle or the organism is a live one, understood na? And what happens in that is that it induces a long lasting immunity.
Right.
Whereas the inactivated vaccines, the organisms is either killed or inactivated, or there is a component of the organism which is put into the vaccine.
Right.
So in these cases, it is not as effective as the live vaccine. However, it has some substances called adjuvants,
yes,
which are put in the vaccine to increase the immunization effect.
Yeah.
So in this case, in inactivated vaccines, the immunity is short lasting as compared to the live attenuated vaccine. So the examples of the live vaccines would be BCG, the oral polio,
yes,
something known as MMR, you must have heard, measles,
yes,
mumps, rubella, and the chickenpox vaccine.
Right.
These are examples of live attenuated vaccine where the component or the microorganism is live. This, okay. In the inactivated vaccine, you have various subtypes which are something like the whole cell inactivated.
Right.
Example is pertussis. Then you have the subunit vaccine in which part of the virus is put into the vaccine. Example would be flu vaccine, tetanus, diphtheria vaccine. Okay, so these broadly would be the two types of vaccines.
Right. So, doctor, how would a vaccination schedule look for a child in his or her first year of life?
Yes. So, according to the Universal Immunization Program, we start right at birth. Within 24 hours of birth, after the baby is born, we give 3 doses. One is something called the BCG. Now, the BCG vaccine is given against severe forms of TB. So, the child remains protected against severe forms of tuberculosis, especially the disseminated TB or the TB meningitis. This is given right at birth. Along with this, the oral polio vaccine is also given and the hepatitis B vaccine. So the child gets 2 injectable doses, that is the BCG and the hepatitis B, and 1 oral polio dose at birth. Then right after birth, at 1.5 month, 2.5 month and 3.5 month, we have the same doses of the primary immunization. Now, which doses are covered according to the Universal Immunization Program is oral polio. So, again oral polio dose is given 1.5 month, 2.5 month, 3.5 month. Along with this, we have a vaccine called pentavalent vaccine, which covers 5 diseases. Then we have the injectable inactivated polio vaccine, which is also given as a separate dose. And finally, we have the oral rotavirus vaccine. So the child usually receives 2 oral doses, rotavirus and the oral polio, and 3 injectables, which are the pentavalent, the inactivated polio, and the pneumococcal conjugate vaccine. And this schedule continues up to 3.5 months.
Okay.
Right after 3.5 months, we directly move to 9 months. There is nothing in between. So at 9 months, we have the measles and the rubella vaccine. In the UIP schedule, MR is given instead of MMR. Then we have the Japanese encephalitis vaccine, and again a booster dose of the pneumococcal vaccine, which is the PCV, is given, along with 1 more dose of the injectable polio, inactivated polio vaccine.
Right.
So in the first year of life, these are the doses that the child would receive.
Right. So doctor, I think this schedule is fixed for every child. I mean, invariably every child will receive this fixed schedule of vaccination. Over and above this, is there any optional vaccines which are available for children?
Yes. There is very less knowledge about these optional vaccines, especially if the patient is going to the health center or the government institution for vaccination, because these vaccines, although very important, are not a part of the universal immunization schedule. Starting with the flu vaccine, you must have heard of it, which is very important to be given at 6 months, 1 dose at 6 months, and the second dose of the flu vaccine is given at 7 months. Now, the flu vaccine protects against severe infections by the influenza virus. It prevents the child from repeated colds due to the influenza virus. This vaccine, flu vaccine, is repeated on an annual basis up till 5 years of age. So, this would be the first optional vaccine. The second optional vaccine would be hepatitis A vaccine. Okay, this protects against a disease which mainly affects the liver, causes jaundice, and is transmitted to contaminated food or water. Yeah, so this is given at around the first dose we give between 12 to 13 months of age, and the second dose is given at around between 18 to 20 months of age. So it's a 2-dose schedule separated by 6 months. The third optional vaccine would be the varicella or chicken pox. So again, the first dose of this vaccine is given at 15 months, and the second dose is again given between 18 to 20 months. So there has to be a minimum gap of 3 to 6 months between the 2 doses that are given. And the fourth one, and a very important dose not to be missed, is the typhoid vaccine, which is given between 6 to 9 months. Okay, and we give a booster dose at around 2 years of age. Right. So these are the optional vaccines that are very important and can be taken outside the government program. Yeah.
Right. So doctor, what are the most common side effects that you see after a vaccine is being administered to a child? I mean, side effects as in the immune system usually kicks in once you give a vaccine, and that is there will be fever and there will be certain symptoms. But over and above these, are there any adverse symptoms that you have come across once a vaccine is given to a patient?
So most of the side effects following vaccination are very mild, as you said. They might be limited to fever for just 24 hours. There might be pain at the injection site. Rarely there might be a small swelling at the injection site.
Right.
In most children, these are the side effects that are seen. The serious side effects are very, very rare. The incidence of these side effects is very rare. Some of them may be after the polio, oral polio vaccine, you can get vaccine associated paralytic polio, which is quite rare. Right. This is when the vaccine virus becomes activated and causes the paralytic polio. Okay. Second would be after the pertussis vaccination, the child can get inconsolable screaming episodes, rarely may get a seizure, and rarely something called as hypotensive, hyporesponsive episodes. But these kind of side effects are extremely rare. Okay, although they are mentioned in theory, but in practice you hardly come across them. Right. Following MMR vaccination, you can have some rare side effects like thrombocytopenia, where the platelet count can go down. But again, these are very rare. But most common ones that we see are just fever for around 24 hours, the child might be slightly cranky or irritable.
Yes.
There might be pain at the site of injection, and there might be slight redness or swelling at the site of injection. That's about it.
Right. Doctor, as you said, vaccination is mandatory for every child, but are there any contraindications to vaccination?
Yes. So the contraindications to vaccination are very few. One of the side effects that I forgot to mention earlier is something called anaphylaxis. So anaphylaxis is something like a severe allergic reaction to the components of the vaccine. And this can be unpredictable because that kind of allergy might have not manifested in the child earlier and may manifest only on giving the vaccine. So if the child has received a particular vaccine and has developed anaphylaxis to it, you cannot repeat the same dose again for the child because the child had developed a severe reaction to it. So that is one main contraindication to vaccination. Another contraindication would be in patients, in children with egg allergy, the yellow fever vaccine which is there cannot be received. But MMR vaccine, many patients feel that MMR vaccine also contains egg, but that is not true. MMR vaccine is safe to be given in children with egg allergy. It is a yellow fever vaccine that has to be avoided. And as I said, in children who have got anaphylaxis, they should not receive the same dose again. So that would be a contraindication.
They won't be getting the booster dose.
Yes, it is prudent to avoid it. Yes.
Right. Doctor, what would be the common post-care tips you would like to share with parents after their child has been vaccinated?
So in my practice, I usually tell the parents what are the side effects that they could expect after the vaccination. Main thing to do is immediately after the vaccination, keep the child around for at least 20 minutes in the clinic to see if the child is having any immediate reaction to the vaccination.
Right.
Second thing, I tell the parents, please keep paracetamol with you. In case the child gets fever or pain, the paracetamol dose, one paracetamol dose should help in relieving the symptoms. Or if there is swelling at the injection site, a little bit of ice wrapped in a cloth and held against the limb will also give a lot of relief to the child.
Right.
So these are the common things that the parents can do to take away the pain that might be present because of the vaccination.
Right. Doctor, is there any particular way that a vaccine has to be stored, or you just go to the pharmacy and you buy it and you take it?
Yeah. So we call it cold chain. Now what is cold chain? Cold chain is the process of storage and transportation of the vaccines in a particular set environment, okay, set temperatures, because these vaccines are extremely sensitive to heat. They get spoilt on exposure to heat, or if that particular temperature is not maintained. So you should have the correct equipment for storage of vaccines. The personnel who are involved in handling the vaccine should also be trained in how to track this temperature, how to maintain the equipment. And obviously, people who are administering the vaccines also need to know how to take care. Now, usually at the pharmacy level or at the pediatrician's level, there needs to be an ice-lined refrigerator, usually with a temperature charting and thermoregulator that usually records the temperature and keeps it set between 2 to 8 degrees Celsius.
Right.
This is the temperature that we need the vaccines to be at to be effective. Anything below that, anything above that, the vaccines will lose their potency. So monitoring the temperature using these specialized refrigerators and probes is very important to maintain the potency of these vaccines. Also, when vaccines are being transported, they have to be packed in vaccine carriers or ice-lined boxes so that the temperature is still maintained. And even if a multi-dose vial is opened, the multi-dose vial should be kept in an ice pack when it is being used and then transported back for the next use in these set conditions. So cold chain is very important to maintain so that the potency and efficacy of the vaccine is maintained and we give the proper vaccine to the child and not the ineffective one.
Right. So doctor, we heard this term herd immunity being used very commonly during the COVID-19 pandemic. Could you enlighten our viewers on the term? What exactly is herd immunity?
Yeah, herd immunity is usually the immunity of a population due to the immunization or natural infection.
Right.
So the people can get immunity either through the infection, natural infection, or through vaccination.
Right.
Now, this is different from herd protection or herd effect. What is herd protection is that the individuals in the community who are unvaccinated, who have not taken the vaccine or have not suffered from the particular disease, they are also safe from the particular disease on account of immunity of the other people. So because of this, the disease will not get transmitted among these people, and the unvaccinated individual will be protected against this disease. Now it works only for infectious diseases which spread from one person to another. Other diseases such as tetanus, which one contracts like from the surrounding, like from soil or infected wound, it doesn't work for that because these diseases are not transmissible. So it works for diseases which are infectious, contagious between people.
Right. Doctor, in spite of the government's initiatives of making immunization mandatory for every child, there is a certain level of hesitancy, vaccine hesitancy as we say, that we still see even in nowadays. So how do you deal with this vaccine hesitancy in your practice?
Yeah. So this is a thing, vaccine hesitancy is a thing which is coming up in a big way in recent times. Usually there are 3 points which are involved in vaccine hesitancy. One is confidence, one is complacency, and one is convenience. Now confidence meaning lack of confidence in the health service provider or the government institution. Okay, what kind of vaccines are they giving us? Maybe it's not of good quality. Okay, they don't trust the health provider enough to get these vaccines done. Second would be complacency. Does my child really need so many doses? Is it important? I don't see this vaccine preventable disease around. So does my child really need this dose? So that is where the complacency sets in. And third would be convenience. The health center is far away from my house. I have to travel so much. So I'm not going to do it. So these are the 3 points that play a big role in vaccine hesitancy. And this would be the reason many children would remain unimmunized, and which is not good overall. Now, what do we do to get over is that we have to talk to the parents. We have to have a positive conversation with them, ask them what are the reasons they feel they don't want to give vaccine to their child. Find out the reason, find out the sources of information that they have gathered this particular information from. And try to understand and then try to correct them. So you will provide them with evidence showing the effectiveness of the vaccines. You will tell them how these vaccines have gone through various clinical trials and they are extremely safe to use. Okay, and finally the role of social media also and influencers obviously in propagating the importance of the vaccines and the need to immunize the children. This would also go a long way in solving this problem of vaccine hesitancy.
Right. So doctor, in your practice, what is the most common questions you get asked by parents on vaccination, and what are the common myths you also encounter that parents have with regards to vaccination?
Yes. So most common questions that are asked by parents are what side effects will this vaccine give to my child? Second thing would be, are so many doses necessary? This is the most commonly asked question. Then it is important to tell them that why these many doses, because there's something called priming and there's something called boosting. As we start the immunization schedule early on, there is something called mother's antibodies which are passed on from the mother to the child in the first 6 months. So these antibodies can interfere with the vaccine. So that's why we have to give more number of doses so that we can overcome this. Second thing is that a baby's immune system is immature, it is still developing. So it needs more number of doses to achieve that level of antibodies. Second question they ask is, if you have to give so many doses because the baby's immune system is immature, why have to give them early? Why you can't give it later when the baby's immune system is immature? So the answer to that is that the vaccine preventable diseases which are there, which are covered by this immunization, are most common and they cause most amount of morbidity and mortality in developing countries like us is in the early phase, in infancy. So we need to protect the babies in this early period of life. That is the most important part. That's why we start the immunization early, and that's why these many doses are required, and we cannot delay it beyond. So this is how I answer this question. Second thing very commonly I get asked is that my child has a cold and cough, so we'll delay the vaccination by 1 week or 2 weeks. So that is not true. When the child is having a cold or cough, it doesn't need to be delayed. It will not interfere with the immune response of the child to that particular infection, or it will not overburden the immunity. Only time we may delay it a bit is in case the child is having a high fever. And the reason for that is that if the vaccine given is also causing fever as a side effect, then we would not know whether it is due to the vaccine or due to the infection that the child is having. So that would be the only reason I would postpone the dose. Third thing I get asked is there any link between autism and vaccination, especially MMR vaccine? So there was a study which was conducted back in early 2000 by Wakefield and all, and it was published in the Lancet, that showed a correlation between MMR vaccination, autism, and small bowel and small bowel infection. So he showed that these were related. But later on, when investigation was done, it was found that all his data was made up, and he had tampered with the data to get significant results. When subsequent around 10 to 12 studies were done to prove this same correlation, they did not find any correlation. Subsequently, this study was taken back by Lancet, and the licensing, the medical license of this particular doctor also was cancelled. So, but it did the damage of sowing the seeds of doubt in the people's mind, which till date people have this doubt. So I would like to say there is absolutely no correlation between autism and MMR vaccine, or any vaccine for that matter. So these are the few questions I get asked often.
Most often. Right. So doctor, the coronavirus is not completely eradicated. I mean, it still lurks in the shadows, and we always find patients coming up, turning up COVID positive. And while the adult population is, most of the adult population is already vaccinated, what are your thoughts on vaccination in children, as in the COVID-19 vaccination for children?
So there are 4 vaccines currently which are licensed for use in children, but most of them are licensed for children above 12 years of age, not below that. Now the Corbevax vaccine is the only one which is licensed for around 5 to 12 years of age. The other vaccines, which include the Covaxin manufactured by Bharat Biotech, which was one of the initial vaccines, that is given for children above 12 years of age, and it's a 2-dose schedule given at on day 0 and day 28. And other vaccines include Zykov vaccine by Zydus Cadila, which is the DNA vaccine. This is also a 2-day schedule. And finally, we have the Covovax also a 2-dose schedule given at 0 to 28 days. So out of these vaccines, only Corbevax is the one which is given to children between 5 to 12 years of age. In terms of the side effects of these vaccines, there is usually mild pain, fever, pain at the injection site, as I said. These are the common side effects. And there were some reports of myocarditis or pericarditis in adolescent children, about around 15 to 18 years of age group, getting myocarditis or pericarditis, but there were no fatalities reported in this. So it was kind of a self-resolving thing within a month or so.
Doctor, are there any new developments in vaccines that have come, or any new vaccines that have been introduced in the recent times?
Yes. So there are some new vaccines that have been introduced, and some vaccines in the pipeline, which is very exciting news. Malaria vaccine is being used in Africa against Plasmodium falciparum, the severe form of malaria, and it is licensed for use by WHO for children more than 5 months of age. It's usually a 3-dose schedule, 4 weeks apart, followed by a booster 12 months later. We also have the dengue vaccine coming up, which would be quite which would be a really good news, especially for people in Goa, as we see dengue virus everywhere. However, these are in the initial phases of clinical trial, and the initial results of these trials are not very encouraging. So only efficacy of around 30-35%. So we might have to wait some more time before we get an effective dengue vaccine. And we also have vaccine against something known as respiratory syncytial virus, RSV. Okay, there's something called ResVax, but it is also not shown promising results. So we might again have to wait 5 to 10 years. This RSV is a virus which causes something called chest infection called bronchiolitis in infants. So that is also a vaccine which we are looking forward to. And there are some more, like there's a recombinant BCG vaccine which is coming up. Then we have the Shigella vaccine which is coming up against diarrheal diseases, and we already have the Ebola vaccine which is being used in Africa for adults more than 18 years of age.
Right. So, doctor, as we come towards the end of this episode, what would be your message to all our viewers, especially parents, on the immunization and vaccination schedule for their children?
Yes, most important message would be not to skip any vaccination.
Right.
Go ahead, take the optional vaccines as well.
Yes.
Don't be overtly worried about the side effects of these vaccines, as most of them are minor.
Yeah.
Hardly there are any serious side effects. And last would be using social media to propagate the message that vaccines are safe, and
Yes.
the importance of vaccines is also something I would like to stress upon.
Right. Thank you, Dr. Nathaniel, for being available to us and spending time with us and giving us so much information on vaccination and immunization. Dr. Nathaniel Pinto is available at Manipal Hospitals, Goa, every day, Monday to Saturday, for consultations. Until the next episode of Health Mantra, take care of yourselves, stay fit, stay healthy, and keep watching Prudent.